Now we will examine the eyes, mouth, and throat. So on the eye exam, you want to note the position, alignment, and any protrusions of the eyes. So standing in front of the patient, you'll again look at the patient's eyes, noting for any abnormalities. Next, you will look at the eyelids, looking at the position of the lids, noting any ptosis, edema, discoloration, and looking at the direction of the eyelashes. So again, I don't note any discoloration, rashes, edema, and the eyelids appear to not be drooping, and the eyelashes themselves all look to be outward facing. Next, we'll look at the conjunctiva, sclera, and cornea. I'm going to lower the lower eyelid, looking at the conjunctiva, noting any discoloration or discharge. Also pull upwards, looking at the superior portion of the conjunctiva. And then also looking at the sclera, looking for any nodules or edema. And then looking at the cornea for any opacities or cloudiness. Next, we'll look at the pupillary size, shape, and symmetry, and doing the direct and indirect pupillary reflexes. On most Snellen charts, you will notice these circles that you can use to gauge the pupil size. So you can hold the chart right up to your patient's eyes and compare the size. So it appears that your pupils are about 4 millimeters. And 4 millimeters on the left as well. Now looking at the shape, and they appear to be round, and you want to make sure that they're symmetrical as well. Now I will use a light source and shine it into each eye twice, looking at the direct and the indirect reflex. You would expect that the pupil will constrict as you shine the light into his eye. You also want to shine the light from an angle instead of straight on, so as to not cause any discomfort for your patient. So that was direct, watching his right eye. Indirect, as I'm watching his left eye. Direct, as I'm watching his left eye. Indirect, as I'm watching his right eye. Now we'll move on to the mouth and throat exam, examining his lips, oral mucosa, teeth, gums, and the roof of his mouth. I'll need a tongue blade and a light source again. So Mr. Williams, I'll be examining your mouth.
Okay.
I'm looking at your lips to see if there are any cracks or ulcers. If you could open your mouth, please. Looking at your buccal mucosa, looking for any lesions. Looking at your teeth to see if there are any dental caries. Also looking at your gums to see if there are any signs of gingivitis. Then looking at the roof of your mouth as well to note any lesions at the roof of your mouth. Next, we'll look at the pharynx, noting the uvula, the posterior pharyngeal wall, palatine pillars, and tonsils. If you could open your mouth again, if you could stick out your tongue and say ah for me.
Ah.
Now we'll examine his lymph nodes. Using small circular or sweeping motions, you'll assess the multiple chains of lymph nodes. So these are preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and if you could shrug your shoulders up, supraclavicular. And now, if you could, lower one side of your gown to expose your axilla. So if you could raise your arm. And so now you'll do axillary lymph nodes as well. Now we will examine the thyroid. First, we will transilluminate to note any nodules that may be seen. And then we'll go through the anatomy of the neck and then palpate using the posterior technique. An anterior technique could also be done. So Mr. Williams, could you turn to your left, please?
Sure.
So using your light, you want to shine at a tangential angle, looking at the right lobe of the thyroid. If there is a nodule, you'll see a shadow that may go across his neck. I will get you some water to swallow. So shining the light across his neck at a tangential angle can transilluminate any shadows that may come across from a nodule. So Mr. Williams, if you could take a swallow. And then looking at the left lobe. So Mr. Williams, could you take another swallow, please? Now we'll go through the anatomy. As you palpate along the midline, the first landmark is the thyroid cartilage. You then move down to a flat area that is the cricothyroid membrane. And as you continue to go down, there's the cricoid cartilage. And so just before that is the thyroid isthmus. So as you maintain your fingers on the thyroid isthmus, you'll ask your patient to take another swallow. So Mr. Williams, could you swallow one more time, please?
Yes.
Again, noting any nodules that you may feel. Now we'll examine each lobe of the thyroid using the posterior technique. First, I will examine the right lobe. I will push from the left towards the right, and then spread my fingers over his right lobe. Mr. Williams, could you take another swallow, please? Now to examine the left lobe, I will be pushing from right to left and then palpating the left lobe with my left hand. Mr. Williams, could you take another swallow, please? Thank you.